So, Welfare Rights Centre is a community legal centre specialising in social security and family assistance law. We provide information, referrals, and legal representation to thousands of New South Wales residents every year who have a problem with Centrelink. Our peak organisations are Community Legal Centres New South Wales, Community Legal Centres Australia, and Economic Justice Australia. We work directly with Economic Justice Australia to advocate for law reform. And as you can see here, a recent submission includes barriers to social security for women outside of our cities. And it's quite surprising reading, and I recommend it to you all. And it's available on the EJA, Economic Justice Australia website. Today, we will be looking at the disability support pension, understanding the basic structure of DSP decisions. We're going to outline the steps in Centrelink's decision making, provide options for obtaining evidence and what is needed. We're going to look at how to spot common pitfalls and the resources that we have that are available for you and your clients. We may be looking at other issues clients may face, appeals of the DSP, and answering your questions. And I'd just like to point out that if you could please keep your questions very general, specific questions will not be answered because we can't get into providing specific legal advice. And on that, this is our disclaimer. It's general information only today. It is not legal advice, and clients should obtain legal advice about their individual circumstances. And now I'm going to hand it over to Donna.
Hi, everyone. Thank you for coming along. So today we're focusing on the disability support pension, and I'm going to start off with a little bit about the general issues that people will have when they're trying to access a Centrelink payment. So almost all Centrelink payments have very specific requirements that are not for just for the disability support pension. You're going to have things like them needing to be a permanent resident visa holder or an Australian citizen, except in special benefit in some circumstances. They're going to have been in Australia when the application was lodged and intend to remain for 2 years after they've lodged their application. They'll need to consider Australia their home. They'll need to provide proof of things like income and assets, and they'll need to give the evidence of what the income and assets of their partner are. They'll need to prove their ID. All of these things are general and are for almost all payments, and they're not going to be what we're talking about today when we're talking about the disability support pension. We're going to be talking very specifically about the requirements to get on this payment. And I'm hoping by the end of today, by the end of this afternoon, this particular image may become quite a useful tool for you to work through how to help your clients, how to help people to get onto the disability support pension. Though at the moment, I recognise that it does look quite overwhelming and confusing. So we're going to slowly work through this slide as the afternoon goes on. When you're looking at the disability support pension, your first thing you look at is whether they've satisfied those non-medical things that I've already talked about. Then you're going to first look at whether maybe they've got what's called a manifest grant of DSP. It's where they have a very particular disability and a very particular condition of a particular severity. That means that they don't have to go through all of the process that is normally required to get on the DSP. So they're looking at things like whether someone has a terminal illness with a life expectancy of less than 2 years, as well as a reduced work capacity, a particular level of blindness called that is defined as permanent blindness, an intellectual disability with an IQ of less than 70, needing nursing home level care, and a category 4 HIV/AIDS. So if you find that you've got a client with any of those, that means that you can just give very specific evidence and skip over everything else required to get onto the disability support pension. A couple of top tips with these ones. Vision, when you're thinking about it, it's not just the visual acuity, it is the field of vision as well. So if you have a field of vision of less than 10%, you can get that manifest eligibility, even if what vision they have is very good. There are specific recommended tests for intellectual disability, and you need to, those tests are listed in the introduction to what's called Impairment Table 9. We'll be looking more at the impairment tables later on. You need to have evidence that you had that intellectual disability when you were a child under 18, but that's all part of that particular table. And the other thing is, as well as we recognise it can be hard to get a doctor to commit to a particular life expectancy, and maybe you can look at whether anyone's ever provided evidence that they can get access to the superannuation early and things like that through a life expectancy assessment. There's particular forms that are available for some of these things. So the manifest grant of blindness has a very particular form that you can look at as well. And it's there, the link to that particular form is on the bottom of that slide. So as I said, we're going to slowly go through this slide today so that I'm hoping by the end it's going to be a useful reminder and a useful tool for you. So having a look at the top, the first thing you're looking at is, are there any issues with that non-medical eligibility for a Centrelink payment? If there's no issues with that, then have a look. Is there any possibility they might get that manifest grant of disability support pension? Because if they do, they skip the rest of this slide. They're just immediately granted. If not, if they don't meet those manifest criteria, then we move on. Someone has a disability of a physical, an intellectual, or a psychiatric disability of some sort. That results in a functional impairment to their day-to-day life of 20 points as measured on particular tables called the impairment tables. And if they have what's called a continuing inability to work, then they may be eligible for the disability support pension as long as they are between the ages of 16 and age pension age, which currently is age 67. So you cannot get the disability support pension if you're under 16, and you cannot apply for and be granted the disability support pension if you're age 67 years or older. So when you're looking at whether someone has that eligible disability, that physical, intellectual or psychiatric disability, Centrelink are looking at 3 very, very specific things before they will say that it's a type of disability that can be assessed under the impairment tables. What they want to see is they want to look at whether it's been diagnosed by someone who is appropriately qualified. So for some things, that's a GP. For other things, they need a specialist to do that diagnosis in writing. They will then need to go, then has that disability, has that condition been reasonably treated? So they want to know whether the normal treatments that are usually recommended for a condition have been attempted, have been looked at, have been considered. If there's treatments that have not been considered, they want to know that it's a reasonable thing to have not done those treatments. So they're looking at whether maybe the treatments are not accessible, maybe they're not affordable for that particular person, maybe there's a 2-year waiting period to get access to that treatment and go through the recovery from the treatment. Maybe they're looking at whether the outcomes aren't going to be reliable. There's not a high chance of success from that treatment. Maybe there's some significant risks. Maybe it's contraindicated because of other conditions, or there could be all sorts of other reasons why Centrelink should say, actually, it's not reasonable that you undertake this treatment before we find that your condition is diagnosed and is reasonably treated and can be assessed for a disability support pension application. They're also, the third thing that they're looking at is whether a condition is stabilised. And when they're looking at whether a condition is stabilised, they're also looking at the treatment that the person has had. So they want to know whether it's managed and under control. They recognise that some conditions deteriorate and will change over time. They recognise that other conditions fluctuate. They know that a condition can be stabilised and changing over time. But what they want to know is if there is any treatment left that might improve someone's condition to a point where they would have the capacity to work and sustain that work for 15 hours a week or more at some stage in the next 2 years. So if there's a possibility that if this person undertakes a particular treatment, that in 18 months' time, they're going to have the capacity to work for 15 hours a week or more, then Centrelink will say that the person's condition is not stabilised, and they will say that the person is not eligible to be assessed for a grant of disability support pension. So you're not looking at whether their condition, what their condition is right now. You're looking at, is there any chance that in the next 2 years, a person's condition might improve so that they can return to work? Yeah. So a lot of you may be familiar with different terms. On the 1st of April 2023, the rules for the disability support pension changed. Previously, you needed to be fully diagnosed, fully treated and fully stabilised, and that's now been changed. It's now diagnosed, reasonably treated and stabilised. So it has made the access to the disability support pension more accessible for people. The final thing that you need to look at in this part of it is you need to look and see whether a condition is going to last for 2 years or more. Okay? If a condition isn't going to last for 2 years, then there's no point having a look at the disability support pension. You won't be eligible. So we thought we'd have a couple of case studies throughout this afternoon to just give you a look at how these rules might be applied.
Shared sound.
Sorry, everyone. It looks like the sound isn't sharing. Is that the case? Just one moment. I'll see if I can fix that. Just a moment. Okay, I'll start that again.
Thanks for joining us, Joe. I've had a couple of chats to Mariam about her DSP application, and I was hoping that as a support worker you might be able to help her with the appeal.
Yeah, I can't understand why Miriam isn't on the DSP already. The GP said she wouldn't need anything else.
Joe and my GP have been so helpful, and I understand why the GP doesn't want to do anything more.
I've had a look at Mariam's medical evidence, and I can see why Centrelink might be rejecting her application. If you'd be able to talk to her GP and psychologist, it could be really helpful. There's a couple of simple things that might be able to make all the difference.
That's great. I'd be really happy to help.
Mariam's told us that she's been seeing a psychologist for 3 years now, and she's also seen a psychiatrist a couple of times. Although the GP's mentioned that in a letter, I can't see anything from either the psychiatrist or the psychologist in the medical documents that I have.
Does she need anything? I thought the GP's letter would be enough.
I was seeing my psychologist every fortnight for 2 years and then monthly last year. I can't afford to go anymore, so I haven't seen them for the past 6 months.
Okay, well look, Centrelink will need proof in writing that a psychologist or psychiatrist has diagnosed your mental health condition. A GP's word isn't enough by itself, but it does help. You'll need to ask your GP if there's anything they have in writing from your psychologist or psychiatrist that shows your diagnosis. They'll also need to see your treatment history to make sure that you're reasonably treated. Joe, do you think you'd be able to help Mariam ask her psychologist's office for a record of all of the treatment sessions over the last 3 years? Centrelink don't seem to have any of this evidence from the psychologist at all.
Yeah, we can do that. That should be simple enough.
Fantastic. Look, the other issue is that the GPs mentioned that they think Miriam should go back to the psychiatrist for a review of her medication. Centrelink have decided that because there's no evidence of therapy and because Miriam possibly needs new medications, that she's not reasonably treated and stabilized. If you can chat to the GP about why her meds need reviewing and if they think she's reasonably treated and won't be able to return to work in the next 2 years, no matter what further treatments she has, then it could help.
She will definitely not be able to work in the next few years. We can contact the GP and make an appointment and explain it to them and get something from them in writing.
Fantastic. Look, I think a single paragraph stating that she's undertaken all reasonable treatment and that although she might have some treatments in the future, there's none available that will improve her condition to the point where she'll be able to work 15 hours a week or more in the next 2 years. I think that might work.
I can't go back to work. No one would give me a job with my employment history and all my medical problems, and I can't be around people.
So thinking about that particular situation, we've got that claim for the disability support pension was lodged and rejected. In this instance, we've got a really supportive community worker and a supportive GP. Centrelink found that her mental health conditions were not diagnosed, were not reasonably treated, and were not stabilised. So thinking back to what diagnosis was, the diagnosis that was needed, is it needed to be diagnosed by someone who is appropriately qualified. And her medical evidence that she provided only had a diagnosis from a GP. There was no record of a diagnosis from a psychologist or a psychiatrist. There was also a recommendation from the GP that her medication be reviewed by a psychiatrist. If you've got someone recommending a review of a treatment, it implies that that review could be of benefit and that the person having that treatment may benefit from a change in the treatment. And Centrelink has to assume that any benefit is going to be significant and will enable the person to get back to work unless there is specific evidence showing that that's not the case. So the solution in this situation was needed to get that evidence in writing from a psychiatrist or a psychologist of the diagnosis and needed to show that long history of treatment, so the long history of therapy. So which that long history of therapy implies that any further therapy will have limited benefit and is unlikely to significantly improve a condition. You also need to get that evidence in writing that the GP's recommendation for a medication review was purely for maintenance and there's no improvement likely, and that if the GP and psychologist can say that they will not improve enough to be able to work 15 hours a week or more in the next 2 years, then that's going to cover off the issues with the stabilised. Okay. Prior to the 1st of April 2023, for mental health conditions, you needed evidence from a clinical psychologist or psychiatrist for a diagnosis. That's no longer the case. A registered psychologist is someone with adequate qualifications to make a diagnosis for a mental health condition. So when you're looking at your client's evidence and what your clients are going to need for their DSP applications, we've got a couple of pitfalls that you might stumble across to just warn you to look out for these. So with the diagnosed, some conditions only need a GP diagnosis. You don't need to pay for a specialist to get the diagnosis. You may need it for treatment or stabilisation, but not all conditions will need a specialist for the diagnosis. When you're looking at reports that contain a diagnosis, watch out for words like exploring or investigating, because that can indicate that they may not have confirmed the diagnosis or they may be wanting to check if there's anything more going on. And Centrelink may say that a person is not diagnosed. So it is really, really important that you get that diagnosis from the appropriate specialist. Sharon lived in a rural town. There were no psychiatrists and psychologists in the town. She'd been seeing a GP and a counsellor for years and years and years for her mental health issues. She applied for the disability support pension, and the GP was very supportive and provided evidence and said diagnosis of depression and anxiety. And Centrelink said that she didn't have a diagnosis that was appropriate for a DSP application. Sharon and the GP spent 18 months trying to get an appointment with a psychiatrist or a psychologist that was bulk billed, that had no gap payment at all, because Sharon couldn't afford the gap. They contacted 60 different practitioners in multiple states, including ones doing telehealth. She was unable to get an appointment with someone that does bulk billed appointments. The last time we talked to her, she wasn't on the disability support pension. We understand that now a policy exists where if someone is in a remote area with little to no access to any health services at all, the diagnosis can be made by an internal Centrelink health practitioner. And the link to the Social Security Guide is there with that information. However, that's only available for people who live in remote areas with no access. It's not available for people in urban areas or in rural areas. Okay. When you're looking at reasonably treated, so looking at what treatments are reasonable for Centrelink to require you to have done, if you've got any evidence with the words included like may benefit from, Centrelink will look at that and go, well, there may be a treatment available that will improve a person's condition to a point where they'd be able to work. They will always have to assume that the benefit is going to be significant. They can't assume that the benefit is minimal unless you give them evidence that that benefit is going to be restricted. Yeah. Some conditions are always going to need a particular type of evidence or particular type of treatment as well. So mental health conditions, they want to see that there's been therapy. Yeah. For chronic pain, they would like to see if there's been pain clinic and that treatment for managing and coping specifically with pain. For things like knee issues, they're going to want to see an orthopedic surgeon, you know, that a knee replacement and things like that have been considered. So when you're looking at helping your client, have a look to past practitioners, past GPs. Have they changed doctors recently? There could be evidence that is there that they've seen, you know, physiotherapists or hydrotherapists and things like that, done hydrotherapy, but it might be in previous GP practitioners' files if they haven't moved their files onto the current one. And if there is more treatment planned, then get it in writing what the outcomes are that are expected. If it's merely to prevent deterioration, make sure you get that in writing, because Centrelink have to assume that it's going to be of a significant benefit. Okay. So some of the common pitfalls when we're looking at whether someone's stabilised or not is if the condition fluctuates, get it down in writing how often it fluctuates, how bad it gets when it's at its worst, and when it's at its worst, how long does that last? Yeah. If this isn't a job application, yeah, if a condition is never going to stabilise, make sure that anything in writing is clear that this is as good as it gets. Yeah. Make sure that if it fluctuates, that you've got it in writing that it gets bad enough that they will be taking a significant amount of leave every time that that condition gets bad. And watch out for reports that haven't been updated with new and current stability. So we'll often see people providing reports from a couple of years ago, and they've told us that they've seen a physiotherapist since then. They've seen a hydrotherapist since then. They've had doctors tell them, look, you just stop now, there's no point. But they're providing reports from a couple of years ago, from before that's happened, and Centrelink have to take it as that being the current condition. Yeah, make sure you get it updated. So we've got an example here of a report that was written for a client with a mental health condition. Okay, and this report caused our client to have her disability support pension rejected. So thought we'd let you have a really quick look at it, see if you can spot anything just on a very quick glance. And then I'll show you where the problems were. And then I'll show you how we fixed it and how we got our client onto the disability support pension. Okay, so very, very quick. If you have a look here, it says she would benefit from trauma-focused CBT with a psychologist. She may benefit from seeking help about an AVO. It might be worth the trial of Cymbalta, which has some benefit for chronic pain as well as depression and anxiety. Okay. She might want to wean off the current medication she is on before starting the new medication. So Centrelink, having a look at this, said she's not reasonably treated because there's a treatment she hasn't trialed, the CBT with a psychologist, as well as the new medication. And it's clear that this particular professional believes that there would be a benefit if she was to undertake those treatments. So she's not stabilised because that benefit may be to a degree that she would ultimately be able to work within 2 years, 15 hours a week or more. So we went back to that particular specialist and we asked if they believed that she would be able to work within the next 2 years and if what sort of a benefit those particular treatments would have. And this is what they wrote in support of our client. I'm a consultant psychiatrist in private practice and I have assessed this person. They have this particular diagnosis. Previous treatments have included multiple counsellors, multiple different medications, limited response, and is now on a different trial of a new medication. Given her past history, current level of support, other psychosocial factors and limited treatment response, I do not expect that further treatment would substantially improve her psychological or functional level to be able to work 15 hours or more a week. And from this letter, combined with the other, our client was granted the disability support pension. So, when you're looking at diagnosed, reasonably treated and stabilised, some conditions have to have a particular specialist. Mental health must be a psychiatrist or psychologist, with that very rare exception. To speed up the process of getting that diagnosis and getting that evidence from a particular specialist, if there's counsellors' notes and social workers that work in the same practice as a psychiatrist or psychologist, they may be able to get their colleague to offer an opinion, based on the treatment that that person has been having. But you can also look in other places that you may not have thought of before. If they've lodged applications for the NDIS or they're on the NDIS, then you can get any evidence provided as a part of that from the NDIA. If they've had access to victim services, then they may have received treatment and things like that through victim services. If they've been hospitalised for mental health conditions, then there's probably going to be a diagnosis on the discharge summary. Get those discharge summaries for if they've been hospitalised for anything, and you might find that there's a diagnosis from the appropriate specialist on the discharge summary. If there's been contact with the justice system, and Justice Health may have records, and any TPD and compensation claims may have records as well. If they've had access with the criminal justice system, they were represented by legal aid, then it might be that some reports were done in support of their defence that could be useful as well. So we're coming back to this particular slide again. And so remember, we've looked at whether there's any non-medical issues that prevent them from getting access to a Centrelink payment. We looked at whether there are any manifest eligibility criteria that means that they can get on without having to go through all of the rest of the process. Then we looked at whether their condition was diagnosed by the appropriate specialist, is reasonably treated and is stabilised, and if it's likely to last for 2 years. And if it's yes to those, then we can move on to the next stage in gathering the evidence to get onto the disability support pension. So at this stage, we thought we'd stop and see if there were any questions that people may have.
Hi, Donna. Yes, we do have a few questions. We have, sorry, I just disappeared. Julia had asked right at the beginning if an IQ is assessed as exactly 70, does that still qualify, or does it need to be 69 and less?
I would need to look at the impairment table to look at the particular wording. Off the top of my head, I can't remember the precise wording of that one, but maybe I can look it up during the break.
And the next question is from Alexis. Is evidence from a GP generally sufficient rather than a psychiatrist or a psychologist for a severe mental health condition where a person resides in a rural area with limited access to other treatment options?
So if you follow that link that I had in the slide for people that are living in remote areas, then your client may be able to access those particular options through Centrelink. But as a general rule, if you're living in a rural area or a regional area and there is access to medical support, especially telehealth and things like that, then a GP isn't going to be adequate. They really, really, really want to see a diagnosis by that specialist, that psychologist, and that psychiatrist, and they want to see treatment of therapy. And previously they really used to really want to see consideration of medications. Under the new rules, I don't know whether they're quite as strict with them wanting to see the medication being considered, but they do want to see the therapy. So it's a case-by-case basis as to whether you can possibly get access to diagnosis through the Centrelink specialist. It's not a, there's definitely no right to access that diagnosis from a Centrelink specialist, and you really have to be in a remote area. My understanding is, but if people have a different experience, then I'd be happy to hear about that.
Okay, and I think there was a question just regarding whether a social worker or mental health social worker was providing counselling. Would that help or be enough?
We will always say provide any evidence of any treatment that you've ever had, but Centrelink may not grant without seeing treatment from a psychologist or a psychiatrist, but the therapy from a psychologist. But if someone has had treatment from a counsellor or a mental health specialist of some sort that is not a psychiatrist or a psychologist, we'll say provide the evidence. Yeah, give it to Centrelink, show an extensive history of treatment, ask them to make the assessment, ask them to make that decision.
Okay, Debbie from Disability Advocacy, can I clarify that you said a registered psychiatrist can offer a diagnosis now? Is this just for Centrelink purposes or is it more universal?
So for access to the disability support pension and consideration of someone's mental health condition, you need to have a diagnosis from an appropriate specialist. And for mental health conditions, a registered psychologist and a GP combined, or a psychiatrist is an adequate medical specialist, medical professional. So it no longer needs the clinical psychologist. A registered psychologist is fine for that diagnosis by a specialist.
Okay, Laurie asked, how long would a client need to be seeking therapies before it is considered a reasonable attempt to treat their condition?
So from what we've heard anecdotally, is that if you've had access to your 10 sessions under a mental health care plan that you get in a 12-month period, and you've used those 10 sessions in that 12-month period, then that would be considered reasonable treatment.
And Mandy has asked a question for later. Means testing. If a person with a disability is about to separate from their partner, which will mean their combined income will no longer push them above the maximum, can they apply now or apply for the future? Or will they have that gap time from when they separate? Sorry, I think that we've jumped into another section.
Look, I have to say that I'm reluctant to give information on that particular topic at this point because it's not DSP specific, but we will always recommend people just lodge an application and test your eligibility. Just test your eligibility. From what I understand, you can lodge an application up to 30 days before you want the payment to start. So you can say, I'm lodging an application and I'll be eligible on X date. But it's the sort of thing you need to be calling Centrelink about, talking to them about, asking them, and lodging an application and applying.
Okay, we have another 5 or 6 questions, but I also know that we've got to move on. So I'll just finish with this one. Whilst waiting for a review, would you advise to reapply for the DSP?
You can have as many applications going simultaneously as you like. And so if you have lodged an application, it's been rejected, you've appealed to an authorised review officer, or you've appealed further to the Administrative Review Tribunal, and something has changed in your health or your client's health, maybe they've received new treatment, they've got a diagnosis for a different condition or received treatment for a different condition that wasn't going to be considered under the one that's currently being reviewed, then yes, put in a new application, because when you're applying for the DSP, they're looking at whether you're eligible on the day you applied. They're also looking at whether anything changed or anything new happened in the 13 weeks after you lodged the application. It's called the relevant period. And anything that's happened after that 13 weeks is not considered in the application at all. So if you've got something that's changed, that's 13 weeks after you lodge the application, then it's a brand new situation that Centrelink will be looking at. And sure, get in a new application, lodge another application that will get them to have a look at what your condition is like now or what's happening now in that new application, and then the review will look at what it was like and at the previous time as it was then.
Okay, I think we should move on.
Okay. So we have another case study for you.
I also want to talk to you both about how Miriam's day-to-day life has been impacted by her mental health.
Yeah, we've been working with Miriam for a few years now, and her mental health really does have a significant impact on her ability to function every day.
Yeah, looking at her medical records, there doesn't seem to be anything in here at all that talks about what you struggle with, Miriam, and what you need help with because of your mental health. The GP said that he thinks you have a severe impairment and then you should get 20 points, but he doesn't say why he believes that. Centrelink needs to be able to make the decision themselves based on information about Miriam's day-to-day life.
All right, so what do we need to do?
I would have 20 points, possibly 30 points if they just really looked at the impairment tables.
Yeah, all right. Well, you'll see in the mental health table there's 6 different areas that Centrelink's going to look at. These include things like self-care and interpersonal relationships.
Yeah, I've got the table open here and I can see that list.
It'd be really helpful if you could write a report or a letter yourself, talking about what you've seen, what you understand Miriam struggles with for each of these 6 areas in the table.
What do you mean?
Well, from what Miriam's mentioned, I understand that you visit her twice a week. You help her to go to buy groceries, visit the chemist, other shopping. But Miriam doesn't leave the house unless you or someone else is with her. You also spend time with her working out what she needs each week. She's also told us that her son calls 3 times a week to check if she's eating properly and showering.
Yeah, that's right.
Yeah, my son is amazing. I couldn't cope without him. I just wish he lived closer.
What about your concentration? Have you noticed if Miriam struggles to concentrate?
Yeah, she loses track of conversations and will start jobs and stop halfway. She's left the stove on more times than I can remember, and it can take her days to put the groceries away.
My son gets really worried I'm going to burn the house down one day.
Ooh, that's no good. Well, look, these are all really important things that Centrelink need to be told so they can understand how a mental health impacts her, and they can make a decision then based on the points. Putting these in a letter with headings from each of from the tables would provide them with some really helpful information to support a claim.
So if you've got a client who's got that diagnosis from the appropriate specialist, they've done all the reasonable treatments that have been considered and are possible to do, they're stabilised, there's no more improvements that they're going to have in their condition within the next 2 years, or no significant improvements, then it's at that point that Centrelink will go, okay, how does this particular condition impact their day-to-day life? What is it that it prevents them from doing? What is it that they struggle to do because of this condition? How might it prevent them from working or engaging in working or sustaining work? It recognizes that just a diagnosis isn't enough, because everyone experiences their health differently. Everyone's health is impacted, or day-to-day life is impacted by their health differently. But the thing is that it needs written evidence from someone other than the person applying. So Centrelink will listen to what the applicant is saying and will listen to how they're describing their life, but they don't take that in and of itself as evidence. They need evidence from a third party. They need evidence from someone else. And the way they assess how someone's day-to-day life is impacted is through what's called the impairment tables. And it's a points-based system. You need to get 20 points on these impairment tables in order to get the disability support pension. So there's 15 different tables. They can give points under each of these tables of 0, 5, 10, 20 or 30 points. As I said, you need 20 points to get the DSP. Those 20 points can be from one table on its own, or you might get those 20 points scattered across multiple tables. So 5 here, 10 there, 5 there, 3 different tables together collectively add up to 20 points. And that's that minimum point number that you need. It's really worth looking at the different tables, because people often remember the first 5, but they'll forget that the rest of them exist, and they can be incredibly helpful. So it's all sorts of things that they're looking at. It's not just, physical exertion and stamina, it's your upper limb, lower limb, spinal and mental health, but it could be communication functions, digestive and reproduction, functions of the skin, issues with the skin, functions of consciousness. So remember that there's all sorts of ones available. Okay? So we had one client who had depression and anxiety and rheumatoid arthritis, and he'd lodged multiple applications. He also had a urinary continence issue that he was too embarrassed to talk to us about. I didn't think it was relevant, didn't tell us anything about it. We looked at his applications, his previous applications. He'd gotten 5 points for the arthritis, 10 points for mental health. We talked to him about his day-to-day life. We looked at his evidence, and we thought Centrelink had made the right decision. We did think that he only had a mild impairment from his arthritis and a moderate impairment from his mental health. And there was no way he was going to be getting 20 points for those 2 conditions. But it took quite a few appointments before he told us about the urinary continence. And when he did, we found out that he was dribbling throughout the day. He couldn't be away from a toilet. He was constantly changing clothes and continence pads. And his GP didn't realise that there was a separate impairment table for continence. So it had never helped him to get that evidence for that application, and Centrelink was never told about it. Now, he'd been to see a urologist. He had the diagnosis from the specialist. He'd had all the treatment. He had everything he needed, but no one around him realised that there was that table available. And as soon as he provided that evidence to Centrelink, he was granted the payment and backdated to the date of his most recent application. So These are the impairment tables. This is what they look like. There's a couple of examples here that we thought we'd show you. I'm not going to spend a lot of time on them. I just wanted you to get an idea about what they look like and what information you can get from them. So table 1, functions requiring physical exertion and stamina. So that exhaustion, that post-exertional malaise where you just have a whole load of recovery time, the pain, that's all examined under here, and it's looking at what sort of physical activities they can undertake. Okay, so 5 points, and they give examples. So they go, you need to be having a mild difficulty with one of these, and they give examples of how that mild difficulty might show. So struggling going to the local shops, a larger workplace, educational training campus. Yep. So struggling with physically active tasks and heavier household activities like climbing stairs, vacuuming floors and mowing the lawns. But to get that moderate impact, you're looking at whether you have difficulty with the moderate household tasks like changing sheets, washing and putting away dishes, sweeping paths. And they have these examples here for you to look at. If you go through the table with your client, talking to them about their day-to-day life, you'll be able to work out where on these tables they might fit. So when you're looking at that 20 points, that severe impairment that gets you the 20 points for the DSP, then they're looking at, do you struggle with those light household day-to-day activities, dusting, folding, putting away laundry, preparing a really simple meal? Yeah. Do they have to rest before and after basic things like having a shower? Yeah. Does having a shower stop them from doing anything else for the rest of the day? And then your severe impairment, they have those examples there as well. So each of those 15 tables has these lists that are really specific to the type of activities that you might do. Mental health has their own list, each of these things, these 6 different categories are listed under each of the different point levels, and they give examples of how someone who struggles with that area, how it might present and how it might show in their day-to-day life. The examples are not exhaustive, but they give you an idea of what you might be looking for when you're talking to your client and what you might need to be saying in your evidence to show what an impairment level is. So, top tips for the impairment tables. A report from the GP is enough. You don't need to go to a specialist to get evidence of impairment level. The GP and information from a GP is going to be plenty. Yeah. Reports that quote the tables are better. So if you can get a report that actually separates out the different parts of the table and talks directly to the different parts of the table, that's going to have a more powerful impact with Centrelink than one that talks in generalities. Yeah. Be domestic, be really specific. Do things like struggle, can't stand at the sink for longer than it takes to rinse out a mug, or needs to sit down 4 times while washing the dishes, or can load the top level of the dishwasher and then needs to go and sit down and then has to go back and load the bottom, or can't put the sheets on the bed so that they fold over the corners, goes over the corners, it's just too hard. So just lies the sheets on top without tucking them in because it's too hard to tuck them in. Be really specific, fell over 3 times last year, once while going down to the letterbox in order to try and get the letters, and now is too scared to walk down the path to get the letters because they don't want to fall over. Paint that picture, tell the story of what their life is actually like. Yeah. The GP, if you make a long appointment, they'll hopefully be able to give you the evidence and write the report during the appointment, because there's no Medicare line item for them to get paid for writing DSP reports, but they can bulk bill for appointments, And if you've got a condition that impacts multiple tables, then get evidence for the multiple tables. You know, things like multiple sclerosis can impact a huge number of tables, and you can get assessed for a single condition under multiple tables if it impacts multiple tables. But if it impacts, say, one of the, say, upper limb, lower limb and spine, as well as pain for table 1, you're not going to get pain as well as, say, spine for the same condition, okay? You're not going to get those conditions, get points for both for that. That'll be considered double counting. But say you've got multiple sclerosis that's impacting, say, ability to walk as well as ability to communicate, then get them both. Yeah. So impairment reports come in all sorts of shapes and sizes, and they can all be impactful, just depends on what's in them. So they can be really short, really simple, really brief, but just contain the information needed. This is an impairment report that got our client onto the disability support pension. You can see it's just got a single sentence under each, but it does talk very specifically about issues that the person has. Yeah. Difficulty walking around shopping centres, difficulty climbing stairs, joint discomfort, and a recommendation of points. Centrelink's not going to accept a recommendation of points on its own. You need to give them information about why those points are recommended. But then you can also get far more fulsome reports that contain a significant amount more information, and that will also be enough to get them onto the payment as well. So this is another example of a report that got our client onto a Centrelink payment. So we're back at our slide set, this particular slide again. Non-medical criteria, manifest eligibility, we've gone through, we've looked at, are they diagnosed, reasonably treated and stabilised, will it last for 2 years? And then we've gone, okay, so what points might the person get? So if you get 20 points on a single table, you're treated differently to if you get 20 points on more than one table. And we're going to talk about that in a minute. But if you've got less than 20 points, then don't bother continuing. You know, if you're not going to get onto the disability support pension, no matter what evidence you get, if you're not impaired to a degree that would get you the 20 points. Okay. So, any more questions before we take a break?
Yes, we do. One question was, how old can evidence be?
So the evidence can be any age. It matters about whether it's telling about what the person is like now. Okay, so for example, if you've got an assessment for an intellectual disability that was done when a person was 16 years old and they're now 50, their intellectual disability won't have changed. And so that evidence is going to be fine. If we've had a client who has had extensive mental health treatment for many, many years with psychiatrist and psychologist, but hadn't actually had any specific treatment for 10 years before they lodged their application. And they were found to be diagnosed, reasonably treated and stabilised, even though that evidence and that treatment was 10 years before. But you're going to find other people with mental health issues who may have had treatment 10 years ago, but Centrelink will go, well, because of the nature of your mental health condition or because of the nature of what has happened since then evidence of 10 years ago isn't enough. You're not reasonably treated, you need more recent treatment because maybe treatment protocols have changed or maybe your mental health condition is presenting differently. So there's no restriction on how old or how long ago the treatment may have happened. It's a matter of, is it talking about what the person is like now or not? Yeah. You're on mute.
Sorry. This is an eligibility issue. If a person has been out of the country prior to applying for DSP or other benefits, does this affect the process?
So there's a few different ways that it may impact the process, but there's no guaranteed anything. So if they've been overseas for an extended period of time, so maybe they were living overseas, they've walked back into the country, and on the day or a couple of days after they arrive, they lodge an application. Centrelink will go, okay, we need to look at those non-medical criteria. Are they a resident of Australia? Do they consider Australia home? Are they planning to stay here for 2 years or more? But that's not a medical question, and we're not talking about that during this session. If they've been overseas for an extended period of time, then maybe all of their treatment was done overseas. So then we're looking at, would Centrelink consider the treatment they did overseas be reasonable? Is that reasonable treatment? And it's too much of a specific, it's too specific to the person and the treatment they received. But those might be things that could be considered, but it is far too specific for the individual. It's too specific to the individual for me to give much advice or information at this stage. It's, for me, to be a case of lodge an application, test your eligibility, see what Centrelink say, and if they say no, then maybe that's when we have a look at why.
Okay. For persons with dual diagnoses, can you comment on whether substance use disorders are as likely to be approved as those on the grounds of mental health, anecdotally?
So anecdotally, we know that nowhere near as many people are granted the disability support pension for Table 6, which is substance use disorders, than those that are granted under mental health. We've also recommended people looking at applying under Table 6 substance use disorder that have had counselling and hospitalisations and all sorts under that particular table to apply under that, but also use that evidence towards an application under mental health if there's a mental health condition as well. So yeah, that's all I can sort of say. Yeah.
Okay, we have a kind of couple of questions from different people around different possible diagnoses. So one is, have you seen people with narcolepsy being granted DSP? Has long COVID? Yes. Okay, long COVID.
I can't remember whether I've seen long COVID granted, but I've seen it considered by Centrelink in application.
Okay. And there's another one. Is ETOH considered a diagnosis and hence impairment?
I can't remember what the words stand for, but from my understanding is that's a substance use disorder, alcohol use disorder. The substance use disorders are under Table 6, and alcohol is one of the substances that is considered under Table 6. So yes, if you've got a substance use disorder that is alcohol-based, they have received treatment for that disorder. The treatment is usually, rehab, maybe detox, could be, there could be medications or, that style of thing. If they've received treatment and the treatment hasn't improved their level of impairment, so they're still using, or the only reason they're not using is because of ongoing treatment, and that ongoing treatment can never stop because otherwise they'll start using again, then they may be able to be considered under Table 6. If you have someone with an alcohol use disorder who's no longer using, no longer receiving treatment, but has long-term impacts from that alcohol use disorder that may include impacts to liver or to brain, then their impacts are not going to be considered under Table 6 alcohol use disorder. Those impacts will be considered under the tables So for brain, will be considered under brain. For liver function, if it causes fatigue, it'll be considered under table 1. So alcohol use disorder or substance use disorders can be a little bit tricky to work out what table they go under and whether someone would be considered reasonably treated or not.
I'm just going to finish on this one for now. And it's more of a comment, and it's just about considering most psychiatrists and psychologists costs, and very few of them do bulk billing. Isn't this indirect discrimination to people on a low income? And so I just thought I'd pull that comment out before we have a break.
So if you think that changes should be made to the system and changes should be made to the legislation, then we recommend that you contact your local MP. I don't know whether contacting Economic Justice Australia would have any value, but they do a lot of policy work. ACOS does a lot of policy work. But, you know, we will always recommend people advocate for changes to the system if they believe that there is issues with it and it could be made fairer.
All right, we'll just take a short break and we'll be back in 5 minutes. Hi, everyone. Welcome back. And Donna's going to take over now.
Okay, so we have another case study for the next section that we're going to be talking about.
Hi, are you the solicitor?
Yes, I am. And I understand you're having problems getting on the disability support pension. Can you tell me what's happened so far?
Yeah, I've been trying to get on the pension, but they won't put me on it, even though I have 20 points and lots of evidence. I don't understand.
Can you tell me what Centrelink told you?
Well, they sent me a letter, and when I called them, they told me that I have not done a program of support. They weren't very helpful, but when they said that, if I didn't like the decision, I could appeal. I have no idea what a program of support is. No one has ever mentioned it before, and the Centrelink didn't explain it either.
Oh, that sounds hard. We're going to be able to help you to understand and work out what your next steps could be. You said you received a letter. Tell me, what did the letter say?
Well, I have everything here. It says the conditions are diagnosed, reasonably treated, and stabilized. They gave me points, but it says I have not done a program of support.
Do you know how many points they gave you for each condition?
It says rheumatoid arthritis, 0 points. They said it doesn't cause any functional impact, which is ridiculous because it's terrible and stops me doing things. The second one is chronic obstructive pulmonary disease, moderate functioning impact, 10 points. But I can't walk upstairs. I'm always short of breath and I have this terrible cough and it's just really hard. I also have depression and anxiety, moderate function impact, 10 points, but I've been diagnosed with severe depression and anxiety. And there's no one to help me now and I'm not coping very well.
Oh, I'm sorry. Are you able to tell me if you've been going to appointments with a job network provider or have you been getting medical exemptions from your GP?
Well, when I first applied, the Centrelink officer said I should apply for a medical exemption because they could see I was really unwell, and my GP said I would never be able to work again. But I've just been getting medical certificates every few months ever since.
Well, you do have 20 points, which is the first step to getting the DSP. But the fact that you've been on medical exemptions and not engaging with your job network provider is the main issue. What I'd like to do is talk to you about your health and see if you've been granted the correct points or if you should have been granted 20 points instead of 10 for any of your conditions. And then we can talk about what you need to do to complete a program of support if the correct points have been granted.
So having a look at that person's particular situation, they lodged that claim for the DSP, it was rejected, they gave lots of medical evidence. They had those first particular steps, they got through those, they were found to be diagnosed, they were found to be reasonably treated, they were found to be stabilised, and they were able to be assessed about how their day-to-day life was impacted by their disability. They had 3 conditions that were looked at, that rheumatoid arthritis that got them 0 points, the COPD that only got them 10 points, and then the severe depression and anxiety that got them 10 points. And they were told that they got their 20 points, which was fantastic, but because they got their 20 points scattered across multiple tables, they had an extra step that they needed to do. So remember before the break when I was saying that if you get your 20 points, depending on how you get your 20 points, you're treated differently. If you get 20 points on a single table, you're treated differently to how the people that get 20 points on multiple tables. And he was told he had to do a program of support, and he has no idea how we could possibly look for work if he wasn't granted the disability support pension because of how his medical conditions impact him. So a lot of you may never have heard of a program of support. We know for a lot of our clients, they've never heard the words program of support until they talk to us, or until they get that letter from Centrelink saying they're rejected because they haven't done a program of support. So a program of support is vocational rehabilitation or employment services that are that a person does, that are required for a person to do in order to improve their chances of finding work and sustaining it and maintaining that work if they find it. Those programs of support are administered through your job network provider. So your disability employment services provider that you go to as a part of your mutual obligations for the job seeker payment or for youth allowance, they're the people that administer a program of support. And generally speaking, those mutual obligations that you're required to do are the program of support. Yeah? If you're not doing your mutual obligations through a job network provider, you're not doing a program of support. And if you get 20 points scattered across tables, then you need to have done a program of support before you can get the DSP. Okay. So that program of support, you need to have done 18 months of that program of support over the course of the previous 3 years. The 3 years before lodging an application, 18 months of those you need to have spent doing your mutual obligations through your job network provider as a program of support. Okay. If you finished the entire program before 18 months is up, then you've done your program of support. If the nature of your disability meant that you were completely unable to participate in a program of support, then you may be exempted from having to do one. Or you were participating, and you were participating at the time that you applied for the DSP, but a program of support was never going to improve your chances of finding or maintaining work, then you might be exempted from having to do a program of support. If you think that you should be exempted or your client should be exempted from doing a program of support, then get a letter from your job network provider exiting them from having to do it. So Centrelink does the formal exit, but job network providers can recommend that a person be exited from the program of support. And there's certain things that should be in those letters to exit you from a program of support. It needs the details of the job network provider. It needs the dates that you've ever participated. It needs when you didn't participate and why you weren't participating, health, disability. It needs to have information about how a program of support acknowledged your disabilities and tailored the program to accommodate your disabilities and help you to improve your condition, taking into account those disabilities. It needs to have a look at how often they were on a medical exemption, how often they had contact with the employment services provider, and maybe what the program of support was and what activities they were required. So this is an example of how a letter might look. It's one that we drafted. It's not an actual a letter from any of our clients, but this is how it might look. And there's all sorts of things that can go into it. Okay. So when you're looking at the program of support, some of our top tips are if someone is on a medical exemption, because this is the big thing. If you are on a medical exemption, those 13-week, or now you can get medical exemptions for up to 2 years. If you're on a medical exemption, you are not doing a program of support. Any time spent on a medical exemption is time spent not doing a program of support. So if your client is on a medical exemption, then wait till they re-engage with their job network provider before lodging a DSP application, because one of those exemptions is not available at all unless you're engaged with the job network provider at the time you lodge your application. Okay, that's if they've got less than 18 months. If you've got someone who's got a huge amount of time left of their program of support to do, and that's going to take too long and too difficult, then maybe have a look and see whether the points level was granted correctly. Have a look and see if actually maybe they should have gotten 20 points under a single table, because then they don't have to do that program of support. So remembering, you only have to do the program of support if you get your 20 points scattered across multiple tables. If you've got your 20 points under a single table, you don't need to do the program of support. So have a look at your client and see if maybe they should have been granted 20 points instead. Another thing as well is that the program of support has to be Commonwealth funded. So training and support done while incarcerated doesn't count. TAFE and uni don't count unless they were approved by the job network provider and incorporated into their mutual obligations. So there's a whole lot of things, rehabilitation and medical treatment done doesn't count towards a program of support unless it's incorporated into the mutual obligations or the program of support by the disability employment service provider. Okay. So common pitfalls that we come across is that support workers, GPs really pride themselves on helping their patients and their clients. They really, really pride themselves on being able to help them to not have to do their mutual obligations that are incredibly onerous and that they really struggle to do. So they fill out those medical certificates to get them exemptions from their mutual obligations. And as a consequence, people's access to the disability support pension can be delayed by, years because they're not doing that program of support. It can add 18 months or more to the whole application process. So be aware when you're helping someone to get that medical exemption that it could be impacting their ability to get the DSP in the future. If you lodge an application for the disability support pension, you're eligible for an exemption from your mutual obligations from the day you lodge that application to the day a decision is made, that first decision is made about whether you're eligible. So if you've got someone who can't do their mutual obligations and is really struggling, you help them to get a relationship going with their job network provider, get engaged with the job network provider so they can get to know them and get to know how they're struggling and the problems they're having with their mutual obligations, knowing that once you've built up that relationship, you might be able to be exited. But also the moment you lodge your DSP application, you can ask Centrelink to exempt you from your mutual obligations and you don't have to do them anymore. And that exemption lasts until that first decision is made. It's not automatic though. You have to contact Centrelink and ask them. You have to ask for it to be coded. It isn't automatically coded. And the other thing is that mutual obligations are meant to be tailored and are meant to be recognising your disabilities and are meant to be tailored to suit them to a level that you're able to do with the disabilities you have. So if you find your client isn't having their mutual obligations tailored by their disability employment services provider, maybe you can help them to negotiate in order to have them adjusted and adapted to their abilities so that they can do the program of support so that they get their 18 months done, and they can lodge an application and be granted the disability support pension, even if they have 20 points over multiple tables. So if you've got someone who hasn't finished a program of support, are not going to get the 20 points on one table, and they're not being able to be exited, look, don't bother appealing the DSP. They're not going to get on. Try and maybe help them to get those mutual obligations adjusted to their abilities and plan a new application in the future after the program's finished. Okay. Adjusted mutual obligations can be limited. Look, I've got there that can be limited to a single meeting with the provider every 3 months. I'm not sure that's actually correct now, and I am sorry about that. We'll have to adjust the video maybe when we do it. I think that maybe it can be limited to conversations with the provider over the phone to a couple of times a month, but I don't think it can be limited to one every 3 months. I just learned that very, very, very just in the last short time. So if you've got a client who has the disability employment service provider is not adjusting their mutual obligations to a level that they can cope with, check whether they've had an ESAT employment services assessment or a job capacity assessment done within the last 2 years. And if they haven't, ask that one is done, because those documents are what the employment service providers use to adjust the mutual obligations. If they refuse to do a new one, if it's been less than 2 years since the last one was done and they refuse to do a new one, ask your GP if they'll write a quick letter saying that a new one needs to be done because the mutual obligations are of a level that they can't cope with. So the final thing that Centrelink look at when they're looking at whether you can get onto the disability support pension is whether you have what's called a continuing inability to work. So if you have a severe impairment, that 20 points on one table, or you've got it scattered across multiple tables, but you've done a program of support or been exited from one, and you can't undertake any work or training in the next 2 years to improve your ability to work, you've been assessed by a job capacity assessor. They want to know if you have an inability to work 15 hours a week or more in the next 2 years. So even if you have, say, 40 points on the tables, if Centrelink think that you could improve your capacity to work to a point where you could work 15 hours a week or more in the next 2 years, then you will not have a continuing inability to work and you won't get the disability support pension. So you need to be unable to work 15 hours in the next 2 years. You need to be able to work only, say, 8 to 14 hours or 0 to 7 hours a week at some point over the next 2 years. And then you will be considered to have a continuing inability to work. And then that's the final step to getting onto the disability support pension. So top tips for continuing inability to work. Those job capacity assessments are what's done in order to assess whether you have that inability to work, and they can be appealed independently. If you think it's incorrect, they've come to the wrong conclusion about your ability to work, then they can be appealed independently. You can provide medical evidence to show that it was wrong and that it needs to be redone. Okay. The thing to remember when thinking about someone's inability to work and whether they can work 15 hours a week or sustain work of 15 hours a week, that it's only looking at the impact a disability will have on your ability to work. It doesn't look at what training or experience you have. It doesn't look at whether you've been, say, a manual labourer for your whole life, but you have an ability to do a desk job, you know, a sedentary job of some sort. It doesn't look at that lack of training experience. It doesn't look at literacy levels. It doesn't look at whether you lack the, the literacy or computer literacy. It doesn't look at criminal records. and whether your criminal record might preclude you from being employed, and it doesn't look at what your job market in your area is as well. None of those are relevant for a continuing inability to work. The thing is that if you've got someone who maybe had extraordinary accommodations, someone's been working for 15 hours a week or more in a job, then Centrelink will go, well, you've got the ability to work 15 hours a week or more, but maybe have a look at how they managed to do that. You might find that they've got an employee who put in extraordinary accommodations for them that are beyond what is reasonably expected in an employment and so provide evidence of that actually they don't have an ability to work 15 hours a week or more in normal open employment. The only reason they were able to do it was because of these extraordinary accommodations that were put in place. Or have a look and go, look, yes, okay, they've been employed for 15 hours or more a week, but actually they've had really excessive sick leave. They've been taking significantly more sick leave than is standard because they can't sustain that work. And that's evidence that they can't work the 15 hours a week or more. So we've reached the end of this slide, and I'm hoping that it now makes a little bit more sense and possibly is more of a useful tool for you. So you've got those non-medical criteria, residency, income, assets, things like that. You've got, do they meet those manifest eligibility criteria, terminal illness, permanent blindness, the different things there. If yes, then they skip all of the rest of it. If no, then you're looking at, have they been diagnosed by the appropriately qualified medical professional? Have they done the reasonable treatments that are normally expected for a condition? Or are there reasons that are reasonable for why they haven't been able to do them? Are they stabilized? Is there any treatment left that will significantly improve their condition? Yeah. And if yes, then you move on to the next one. Is their condition going to last at least 2 years? If yes, we move on and we go, how does that condition impact their day-to-day life? What does it mean that they struggle with? What does it prevent them from doing? And what evidence do we have that can show that beyond just my client talking about what their issues are? If they have 20 points on one single table, a severe impairment on a single table, then have they got that assessment saying that they are unable to work 15 hours a week or more in the next 2 years? And if that's yes, then they should be eligible for the DSP. Now, if they got their 20 points scattered over tables and they got 20 points, on 2 or more tables, then have they done that 18-month program of support? And if yes, have they been assessed as being unable to work 15 hours a week or more in the next 2 years? And they should be granted the DSP. So there's quite a few different places around where you can get a lot of information and a lot of help on supporting your clients to get the DSP. So there's a fact sheet on Economic Justice Australia's website on the disability support pension. And Social Security Rights Victoria has a DSP medical evidence bot that you can put in all sorts of information in there, and it prints out, it gives you a letter that you can provide your doctor in order to explain to them what evidence you need from them to support your application. On our website, we have a huge amount of information and a lot of links that are there as well. It's well worth taking the time to explore. So it's a whole section on how do I get the disability support pension with a fact sheet that you can print out, as well as other links to other medical evidence. So we have an introductory letter for your doctor. We have links to all of those impairment tables that I was telling you about. And we've also got links to template reports that your doctors can use to fill in. It's a ticker box and fill a box, and as long as they fill in all those bits and pieces, then all of the information that Centrelink need will be covered in that letter or in that report. So you've got all the different tables and then the template reports and links to get them as well. When you're looking at that template doctor's report, then this is the sort of thing it's going to look like. It has the name of the doctor, it has the diagnosis, it has who diagnosed, it gives you opportunity to attach supporting evidence, and it gives all sorts of space for you to talk about how someone's day-to-day life is impaired within that report. Okay, so any questions?
Yes, we do. We have a lot. I think there's quite a few questions around the program of support. We have a question around, in their experience, when DES providers trigger the request to exit, it is very rarely accepted by Centrelink. Is the request sufficient or does it need to be accepted?
So my recommendation would be that if it's not accepted by Centrelink at that original decision or the authorised review officer's level, then appeal it to the tribunal, because the tribunal may accept it and may recognise that they should have been exited.
Okay. And another one is, what can you do if a DES provider is unwilling to provide exit documentation or a referral? Can a person fill out a pro forma exit request form and submit to Centrelink?
Look, it's one of those ones where there's no nice, neat pro forma exit request for a person to fill out themselves. They can maybe talk to the tribunal and say, I should have been exited. But you also have a choice. You can choose your disability employment service provider, and it may be that you'll just need to leave and find a different one that will exit you.
Okay, and there were a few questions around, are there alternatives to official programs of support? So could a similar program such as workers' compensation or job seeking program be recognised as a program of support? Or if you volunteered at a church and did training and completed courses, not through a JNP?
No. Unfortunately, the legislation is very, very, very specific. It must be Commonwealth funded, and it must be a Commonwealth funded program of support. And my experience is that to my knowledge, but someone may have different knowledge than me, is it is only through those employment services providers that you get that Commonwealth funded program of support. The other tricky thing is, as well, as you'll find people who are on medical exemptions from having to do their mutual obligations, but they voluntarily engage with their disability employment services provider. Anytime voluntarily engaging with the disability employment provider is not included in time spent doing a program of support. So they may spend 12 months on an exemption and 12 months voluntarily engaging and doing everything that would have been included in a program of support, and it will not count towards their program of support.
That's harsh. Okay. If someone has multiple conditions, I think this is someone just really clarifying, and I know you've said it a few times, but if someone has multiple conditions that fit under the one table and they collectively add up to 20 points, would that mean they don't have to do the program of support?
You can only be granted points under a table once. So you might have 3 different conditions, all of which impact your lower limbs. You will only get points under lower limb once. They will look at the condition that impacts you the most severely and give you those points for that. So you might have a condition that impacts you to a mild degree and 2 conditions that impact you to a moderate degree. You will still only get 10 points. You cannot get multiple points under a single table.
Okay, and is the 18 months continuous participation in the program of support?
No, it's 18 months over the course of 3 years, and it can be a month here, 3 months there, 6 months there. You know, it's as long as you've got the number of days required over the course of 3 years. It doesn't have to be continuous.
And if you do a program of support, can you then be considered eligible to work more than 15 hours a week? So they're not given DSP.
So a program of support is meant to improve your ability to find and maintain work. And if it has succeeded in improving your ability to find and maintain work, so that you then have the ability to find and maintain work of 15 hours a week or more, then no, you won't be able to get the DSP.
Okay, and are ESATs requested directly through Centrelink or through the DES provider?
I think that you can talk to Centrelink and ask for them, but I imagine, but I don't know, but I imagine you'd be able to talk to your disability employment service provider and say, can you please arrange for an ESAT? Or can you please arrange for, an assessment? You're generally not actually allocated to a disability employment services provider until an ESAT is done, because they want to assess that you actually have a disability that impacts your ability to work. So they do an ESAT and then send you to a disability employment services provider. That's my understanding.
Okay. And I think Laurie's been trying to get this one answered. It's how long would a client need to be seeking therapies before it is considered a reasonable attempt to treat their condition, particularly for things like chronic pain or physical injuries, disabilities?
Completely depends on the patient and completely depends on whether the doctors would go, there's no more significant benefit that you can get from this. If you're looking at what would be considered reasonable under it being affordable, then what's available under the public health system. But I can't say that for this particular condition it is only ever this, because everyone's disability impacts them in a different way, and everyone reacts to treatment in a different way, and everyone needs a different type and level of a treatment. Yeah. So I can't give you I'd love to be able to give you a nice definitive answer, and I can't.
Okay. And are there any resources on how someone could go about asking a JNP to include TAFE or uni studies as part of their POS so that it can count towards the 18 months requirement?
No, there's no resources available. It's meant to be able to be negotiated. If you're struggling to negotiate, then ask your support person to go with you and maybe you can have a conversation together. But no, there's no, I don't know of any resources. Someone else might, and they may be able to put links in the chat.
Okay. Just one more. If a client is living with significant impairment, however, has not received a diagnosis, are they even eligible for DSP, particularly if all methods of seeking a diagnosis have been explored, e.g. various assessments of physical health show impairment, but a diagnosis has not been found?
So if it's just that you haven't got a diagnosis, but it's a normal, a standard condition that is easily diagnosed, then no, you will not get the DSP without the diagnosis. If you've got a condition that is incredibly unusual and there's a reason why you've got, no specialist can pin it down, talk to Centrelink and see if they've got any ideas or solutions for you. That is a requirement of the legislation that you have a diagnosis by the appropriately qualified medical professional. So it's going to be a matter of seeing if you can maybe provide evidence of a whole load of specialists going, they've got this condition, but we cannot give a diagnosis. If you can get them to put it in writing. Don't know. I think it's too individual specific, that one. I think I'd struggle to give any information without actually without giving advice.
Okay, that's it. Let's move on.
Okay. We're in the final bits. So these are some extra bits and pieces that people might find useful. There are international agreements with a lot of different countries, and access to the disability support pension is available through a lot of those agreements. One of the ones that's used most commonly is the international agreement with New Zealand. So if you have someone who is a New Zealand citizen and living in Australia and not eligible for a Centrelink payment because they're not on a visa that gives them access to Centrelink payments, they may be eligible for the disability support pension through the New Zealand agreement. It's harder to get on through this agreement. You need to have a severe impairment. You need 20 points or more under a single table. You cannot get your 20 points scattered across tables. And you need to have a continuing inability to work of less than 8 hours rather than less than 15, which is what is normal under the Australian Disability Support Pension rules. But it's well worth exploring if you've got a New Zealand citizen that you're helping. If you've got someone who's relatively recently arrived in Australia, then you might also find that they're not able to get the disability support pension because there's what's called a qualifying residence period. You need to have resided in Australia for 10 years in one stretch, or resided in Australia for 10 years with one period being at least 5 years. So it can be over multiple time periods, these 10 years, but one period must be at least 5 years. And until you've got those 10 years qualifying residence, you won't be able to access the disability support pension unless you were living in Australia at the time that your inability to work arose. So at the time that you became disabled, or that your health condition deteriorated to a degree that it prevented you from being able to work. So as long as if you're in Australia at that when that happened, then you won't have to have that 10-year qualifying residence period, but otherwise you've got to wait 10 years. You can travel outside of Australia and still be paid the disability support pension. Some payments you can't. For the disability support pension, you can. You can be paid for 28 days outside of Australia in any rolling 12-month period. If you're outside of Australia for more than 28 days, then your DSP will be suspended. And if you stay out for 13 weeks, it will be cancelled and you'll need to make a new application when you return to Australia. It is possible to apply for what's called indefinite portability. However, we strongly recommend that you do not lodge an application for indefinite portability without getting advice, because they will reassess your eligibility for the payment, and we find that some people have their DSP cancelled after applying for indefinite portability. It is possible to have your eligibility for the disability support pension reviewed while you're receiving it. So they may look and check to see whether you're still medically qualified for the payment, and it can be cancelled with 6 weeks' notice if you're found to no longer be medically eligible. Some of those common triggers for a review are that application to be paid DSP overseas indefinitely, or if you're regularly reporting income from working of more than 15 hours a week. So if you are on a income support payment while looking at applying for the disability support pension, it is possible to get exemptions from those mutual obligations, remembering that any exemptions from mutual obligations won't be counted towards your program of support, but you might find that you have a client that just needs to get that exemption anyway. You can get exemptions for a temporary incapacity to work, which can be a temporary condition, or it might be that your permanent condition has been exacerbated temporarily exacerbated, it's gotten worse. And you're now able to get exemptions for up to 2 years from having to look for work and having to do your mutual obligations, but remembering the impact it can have on your ability to get DSP because of the program of support. And then remembering that you can also get that exemption because you've lodged an application for the disability support pension, but you don't get exemptions from your mutual obligations through the appeals process. So you might be rejected for the DSP, appeal it to the next level. You're going to have to do your mutual obligations while appealing through. You don't get that exemption. Okay. So you can work while you're on the disability support pension, okay? There's an income test. So as with most Centrelink payments, you need to be reporting your income fortnightly if you're working. And depending on how much income you're getting, it might reduce the amount of money you get from the DSP because of that income test. If your income pushes you over the limit and you are receiving zero money from the DSP, your DSP won't be automatically cancelled. You will still be considered to be on the DSP for up to 12 to 13 fortnights, receiving zero money from Centrelink for the DSP. Your DSP will still be active as long as you're reporting fortnightly. So you've just got to tell your clients to report fortnightly to make sure that their DSP continues even though they're getting no money, so that if their income drops down under that income limit, the DSP will just be paid again. You know, they don't have to lodge a new application. Now, depending on the hours that you work, it can impact your eligibility for DSP. If you start working 30 hours a week, you're automatically considered not medically eligible anymore and your DSP is cancelled. So if you've got someone who's thinking about working 30 hours a week or more, tell them to contact Centrelink and have their DSP suspended. First, they can have their DSP suspended for 2 years. Okay, and that means that if their hours drop below 30, they can just have the DSP restarted. All right, we'll quickly race through appealing a decision. So when you're looking at whether you want to appeal a decision to reject your application for the DSP, you get that original decision of rejection. Then you can appeal it to what's called an authorised review officer, which is an independent person inside Centrelink. And then you can also ask for an explanation of a review instead of appealing to the authorised review officer. If you get that authorised review officer's decision, you can then appeal to the Administrative Review Tribunal, and there's 2 levels of appeal within the Administrative Review Tribunal, and then you can also appeal to the Federal Court. Remembering that the Federal Court is a cost division, it'll cost you to apply, and you might be found liable to pay the legal costs of Centrelink. So there are strict time limits for lodging appeals of decisions. If you've been rejected for an application for a payment, it's 13 weeks to appeal that decision to the authorised review officer and then to the Administrative Review Tribunal, and then it's 28 days to appeal to the second level of the Administrative Review Tribunal and then to the Federal Court. There are other strict time limits as well. There's no time limit to appeal a debt, so don't appeal debts without getting legal advice first. So we will sometimes go appeal your DSP rejection, even if we think you have no merit, because those original letters that you get don't always contain all the information you may need to understand what went wrong and what you may need in an application in the future. The letters have a lot more information now than they did in the past. So just make sure that you really do need to get that information from an appeal before you do it. And so, yeah, it just can be a very useful tool to get information if you haven't been able to get it elsewhere. Remembering 60% of all applications are rejected at first instance, but people do successfully get on the DSP on an appeal. It is well worth appealing if you think you can get the evidence and you think you might be eligible. You can get evidence that is at any time. You can get evidence a year after you lodge the application, as long as it's talking about what your conditions were like on the day that you applied and the 13 weeks after. As I said right at the beginning, you can lodge a brand new claim as well as appeal an old one. It's looking at what you were like on the day you applied and people's health changes. And legal aid can represent at both levels of the tribunal. Legal Aid New South Wales, we're located in New South Wales, so we talk New South Wales. Legal Aid New South Wales can represent at both levels of the tribunal, and they have grants for medical reports, so you might be able to get their assistance. But my advice is always focus on what will get you there the easiest, the quickest, and the cheapest. Have a look at all the different health issues that your client has. And if there's something that will get them 20 points that they've already got all the specialist evidence for, don't pay for reports for everything else. Focus on what's cheapest for your client. Okay. All right. So that is that for this section. Are there any questions?
Yes, well, we have two people who believe that it's a bit confusing if so Ben says, sorry if the answer is obvious, but why does Centrelink require someone to be incapable of working 15 hours or less a week to qualify, but once on DSP, they allow someone to work up to 29 hours per week? Seems inherently contradictory.
Well, look, it seems it on the face of it, but actually it isn't. They recognise that DSP is a really long-term payment that someone may be on for, for the rest of their life or their working life, and people's health can change. And 5-10 years after you get the DSP, then maybe your abilities to work have changed slightly, and you might be able to work for a period of time. But they also go, you get the DSP because you cannot sustain work over a period of time, which doesn't mean to say that you can't work in very short bouts for it might be that you would not be able to work for 15 hours a week or more for a year, but you can for 2 or 3 weeks. Yeah. So it's recognizing that actually people's health have all sorts of different impacts.
Okay, and I think that was just added to by potentially, would this allow for people employed through an ADE or supported employment arrangement?
I don't know what an ADE is, but if it's
I'm not sure.
Yeah. So if you're talking about people who are in supported employment and they would be unable to get work on the open marketplace, then that's another whole aspect of being trying to get into the DSP. Because for the DSP, whenever you're talking about employment, is can you get work in the open marketplace? And if you can only be employed under supported employment, then that's another pathway onto the disability support pension that we don't cover in this particular presentation. Okay, so.
Thanks, Donna. Oh, thank you, Donna. Okay, so thank you very much, everyone, for staying with us over this long webinar that has been amazing. I think it really clarifies a lot of the issues and the step-by-step process to accessing DSP. If you would like to know more, we do have some places available still for our community of practice. We have been running a community of practice for the DSP for the last 2 years, and we have another one starting very soon, and that will involve a 4-hour workshop and 10 sessions, monthly sessions, that will take us up to next May. So if you are interested in that, please check the link on your in your slides or the link in the chat that should appear very soon. And there's some more information about the DSP community of practice on this top link, and you can fill in our expression of interest there. If you have clients and you would like to refer them to the Welfare Rights Centre, our intake days are Monday and Wednesday from 9:30 to 12:30 p.m. And we also have a website inquiry that is available at all times. Please follow us on social media. We'll keep you up to date on what we're doing and what our next webinars are. We have those on our website too, so please stay in touch. And finally, we would really appreciate it if you could fill in our evaluation survey. This really helps us to find out how we're doing and helps it keep all our training free and provides that data to the funders. So thank you again for coming, and we look forward to seeing you next time. Thanks.